Have you ever taken a moment to think about the worst effects of the medication you are taking? Well, if not, it's time to shed some light on something many of us may not have considered. So in this video, I have some important information to share with you about Tamsulosin, or Flomax, a medication widely used in men for an enlarged prostate. In simple terms, Tamsulosin works by relaxing the muscles in your prostate and blood, and by doing that, it helps control the symptoms of an enlarged prostate. But here is the thing: beyond its known benefits, taking Tamsulosin comes along with some side effects that may catch you by surprise. From unexpected vision changes to changes in sexual function, we are going to uncover these worst side effects of Tamsulosin that you need to know. Note that every medication has side effects, and these side effects might not be experienced by everyone. Speak to your doctor or pharmacist when you start experiencing any of these side effects. Welcome, and please like and subscribe to the channel. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. With that said, let's jump in. Number 1. Priapism. Did you know that a medication commonly used for urinary issues could cause an erection that won't go away? We're talking about Tamsulosin and a rare but serious side effect called priapism, an erection lasting longer than 4 hours that isn't caused by sexual stimulation. While it might sound like an odd side effect, it's a medical emergency. Here's how it happens. Tamsulosin works by relaxing muscles in the prostate and bladder to improve urine flow. But it also affects certain smooth muscles in the penis, specifically by blocking alpha-1 receptors. These receptors help control blood flow during an erection. When they're blocked, the blood gets trapped, and the erection doesn't subside. A case published in the Journal of Clinical Pharmacy and Therapeutics reported a man who developed painful, prolonged erections after only a few doses of Tamsulosin. Once he stopped the drug, the symptoms resolved, pointing directly to Tamsulosin as the cause. Another case report published in Urology, 2002, also found a similar association and emphasized the need for prescribers and patients to be aware of this side effect, albeit rare. These studies show that while priapism is not common, it is a recognized and potentially dangerous effect of alpha blocker therapy, including Tamsulosin. Now here's the danger: if priapism isn't treated quickly, it can lead to permanent damage, including erectile dysfunction. That's why any erection lasting more than 4 hours should not be ignored. It requires immediate treatment, usually by draining the trapped blood or injecting medications directly into the penis to shrink blood vessels. Doctors typically avoid prescribing Tamsulosin to men who've had priapism before or who have blood disorders like sickle cell disease. If you're starting this medication, it's critical to watch for unusual symptoms and speak up if something feels wrong. So while Tamsulosin may help your bladder, it's important to know that in rare cases, it might cause this unexpected and dangerous reaction. Number 2. Retrograde Ejaculation. Here's something most men don't expect when taking Tamsulosin: reaching orgasm and noticing nothing comes out. This phenomenon is called retrograde ejaculation, and it's one of the more surprising yet common side effects of Tamsulosin. It happens when semen flows backward into the bladder instead of exiting through the penis during ejaculation. But why would a medication for prostate problems affect ejaculation at all? Tamsulosin works by relaxing the smooth muscles in the prostate and bladder neck to improve urine flow. But those same muscles are supposed to tighten during ejaculation to make sure semen travels in the right direction, out. When those muscles are too relaxed, the bladder opening stays open during orgasm, allowing semen to take a detour into the bladder. Now, this doesn't usually cause pain or long-term harm. Some men may not even notice unless they're trying to conceive or are particularly concerned about the absence of semen. But for others, it can be distressing, especially if they don't expect it. A clinical trial published in European Urology found that up to 18% of men on Tamsulosin experienced some form of ejaculation disorder, with retrograde ejaculation being the most common. And interestingly, it tends to happen more at higher doses, especially the 0.8 mg formulation. So what can be done? Well, the first step is reassurance. This is a reversible effect, not permanent, and not dangerous in most cases. If the symptom is mild and not bothersome, many men choose to continue the medication. But if it's affecting your quality of life or fertility, your doctor might reduce the dose or switch you to another medication, like alfuzosin, which is less likely to cause this issue. Bottom line, retrograde ejaculation might be unexpected, but it's manageable and reversible. And if you know about it ahead of time, you'll avoid a lot of unnecessary worry. Number 3, orthostatic hypotension. Imagine standing up from your bed, and suddenly, the room spins, your vision blurs, and you feel like you might faint. If you're taking Tamsulosin, this isn't just bad balance, it could be a sign of orthostatic hypotension. That's the medical term for a sudden drop in blood pressure when you stand up. Tamsulosin relaxes muscles in the prostate and bladder to help with urination. But here's the catch, it also relaxes blood vessels, even though it's designed to mostly target the urinary tract. This can make it harder for your blood vessels to squeeze tightly and push blood up to your brain when you change position. The result? Less blood reaching your brain for a moment, causing dizziness, lightheadedness, or even fainting. And it can happen more easily in older adults or those already on blood pressure medications. In a study published in the Journal of the American Geriatrics Society, researchers found that even Tamsulosin, which is considered more selective and safer than older drugs, can still impair the body's ability to maintain blood pressure when standing, especially in seniors. Another large study published in Drugs and Aging in 2012 emphasized that while Tamsulosin is generally well tolerated, it should still be used with caution in frail older adults or those with existing cardiovascular instability. The study noted that the incidence of falls and syncope associated with orthostatic hypotension was non-negligible in elderly populations using Tamsulosin. So what should you do? First, timing matters. Doctors often recommend taking Tamsulosin at night, before bed. This reduces the risk of dizziness during the day. Second, always stand up slowly, from a lying or sitting position. Let your body adjust. Third, stay well hydrated and avoid alcohol, which can make the blood pressure drop worse. And finally, don't ignore these symptoms. If you feel faint or you've passed out, that's something to bring up with your doctor immediately. Adjusting the dose, or switching medications, might be necessary. Orthostatic hypotension might sound like a complicated term, but it's just your body's struggle to keep your blood pressure stable, and with Tamsulosin, it's a side effect you need to be prepared for. Number 4, vision changes. When you think of a prostate medication, you probably don't expect it to affect your eyesight. But some men taking Tamsulosin report a surprising side effect, vision changes. It might be subtle, like blurry vision, trouble focusing, or discomfort adjusting between bright and dim lighting. But for some, it can feel like their eyes just aren't working the way they used to. So, how does a urinary drug affect your eyes? The answer lies in those same alpha-1 adrenergic receptors that Tamsulosin targets to relax the prostate and bladder neck. These receptors are also found in the iris and ciliary muscles of the eye. They help control pupil dilation and how the eye focuses, especially when switching between near and far objects, a process called accommodation. When Tamsulosin blocks those receptors, it can slightly interfere with how the pupil reacts to light and how the lens adjusts to focus. That can lead to blurriness, trouble seeing in the dark, or even mild eye strain, especially for tasks like reading or night driving. In most cases, these visual changes are mild and reversible, but they can still be disorienting. One study published in the Journal of Ocular Pharmacology and Therapeutics looked at patients using alpha blockers and found that, although rare, Tamsulosin was linked to transient disturbances in visual focus. Other reports collected by the World Health Organization's Global Pharmacovigilance Program have documented blurred vision and eye discomfort in people taking Tamsulosin, often resolving after the medication was stopped. So, what can you do if your vision changes after starting this medication? First, take it seriously, but don't panic. If the change is mild and you've recently started Tamsulosin, your body may adjust. But if it persists, talk to your doctor. They might reduce the dose, or in some cases, recommend switching to a different medication. And if you already have eye conditions like glaucoma, macular degeneration, or a history of poor night vision, make sure your eye doctor knows you're taking Tamsulosin. Avoid driving at night or operating heavy machinery if your vision feels off, especially in the early days of treatment. So while it's rare, vision changes can happen with Tamsulosin, and knowing what to watch for can help you stay safe and see clearly. Number 5. Skin rash or itching. Tamsulosin is often seen as a safe and well-tolerated medication, and for most people, it is. But for a small group of patients, it can do something unexpected. It can make your skin go haywire. We're talking about skin rash, itching, and in some cases, full-blown allergic reactions. It might start as a mild itch, a few red patches, or a rash that looks like hives. But in more sensitive individuals, it can escalate to swelling, welts, or even a condition called angioedema, where parts of the face or throat swell dangerously. So, how does this happen? Tamsulosin, like many drugs, can trigger an immune reaction in some people. Your body might mistake the drug, or one of its breakdown products, as a foreign invader. When that happens, your immune system fights back, often by releasing histamine, which causes inflammation, redness, and that annoying itching sensation. In mild cases, it can feel like dry skin or a harmless allergic rash. But in more serious situations, the reaction can spread or worsen rapidly. A case report published in Drug Safety Case Reports documented a man who developed widespread itching and hives just days after starting Tamsulosin. The rash went away quickly once he stopped taking the medication, confirming the link. Hundreds of similar cases have been logged in the FDA safety database, showing that while this side effect is rare, it's real. If you notice a rash or itching soon after starting Tamsulosin, don't ignore it. It could be a coincidence, but it could also be the first sign of a hypersensitivity reaction. The good news? Most cases are mild and manageable. Antihistamines like cetirizine or diphenhydramine can calm the itching. A soothing cream or a mild topical steroid can reduce inflammation. But here's the golden rule: if the rash spreads, your face starts to swell, or your breathing becomes affected, go to the ER immediately. That could signal a dangerous allergic reaction. And of course, always tell your doctor if you've had a drug allergy in the past. If Tamsulosin doesn't agree with your skin, there are other medications, like alfuzosin, that might offer the same benefits without triggering your immune system. Skin side effects might not sound serious at first, but they're your body's way of waving a red flag. Pay attention to it. Lastly, fatigue and weakness. Let's be honest, we all feel tired sometimes. But if you started Tamsulosin and suddenly feel drained, sluggish, or like your energy got up and left the building, you're not imagining it. That overwhelming fatigue and unexpected weakness could be a side effect of the medication itself. Tamsulosin works by relaxing smooth muscles in your prostate and bladder to help you urinate more easily. But what many people don't realize is that it also relaxes blood vessels. And that's where the trouble can start. When your blood vessels relax, your blood pressure can drop slightly, even if you don't notice it. And even a small pressure drop can mean less oxygen and nutrients reaching your muscles and brain, leaving you feeling tired, foggy, or physically weak. But that's not all. Tamsulosin may also affect alpha-1 receptors in the brain. These receptors play a role in mental alertness, energy, and the body's natural wake-up response. While Tamsulosin is designed to mostly act in the lower urinary tract, small amounts may cross into the brain, especially in older adults with a more permeable blood-brain barrier. That might explain why some men feel mentally dull or emotionally flat while on the drug. A study published in BJU International reported that fatigue and asthenia, which is just a fancy word for weakness, were among the most frequently reported side effects of Tamsulosin, especially during the first few weeks of treatment. And in real-world settings, patients often chalk it up to aging, not realizing the drug may be contributing. So, what should you do if you're feeling like your battery is constantly on low? First, give it time. Many people adjust after a week or two as the body stabilizes. Second, try taking the medication at bedtime. That way, you sleep through the period when fatigue tends to hit hardest. But if the tiredness is affecting your work, your mood, or your ability to function, it's time to talk to your doctor. They might suggest reducing the dose or switching to another medication with fewer central effects. And make sure you're not stacking the problem. Combining Tamsulosin with alcohol, sleep aids, or blood pressure medications can make fatigue worse. Stay hydrated, move around, and prioritize sleep. These simple steps can make a big difference. Remember, managing your prostate symptoms shouldn't come at the cost of your energy. If you feel unusually weak or worn out while on Tamsulosin, trust your body and have the conversation. You deserve to feel better, not worse. So, there you have it, 6 unusual side effects of Tamsulosin that most people never hear about. From priapism and retrograde ejaculation, to fatigue, visual changes, and even complications during cataract surgery, this medication may be helpful for urinary symptoms, but it's not without its risks. Now, to be clear, Tamsulosin works. It's helped millions of men manage the frustrating symptoms of an enlarged prostate. But no drug is perfect. And when it comes to your health, knowledge is power. If you or someone you love is taking Tamsulosin, pay attention to how your body responds. Are you feeling dizzy when you stand up? Are your eyes acting differently? Do you feel more tired than usual or notice changes in sexual function or skin reactions? These aren't just random annoyances. They could be your body sending you a message. Don't ignore it. Talk to your doctor. There may be alternative medications, adjusted dosages, or simple strategies that make all the difference. And remember, just because a side effect is rare doesn't mean it won't happen to you. Staying informed is the first step to staying safe. If you found this video helpful, be sure to hit the like button, subscribe for more medically backed health content, and share this with someone who might be taking Tamsulosin. Thanks for watching, and take care of yourself.